Namaskar. Nowadays, the rate of diabetes is increasing around the world, including in India. According to reports, the estimate number of diabetic patients in the 20 to 79 age group is 74.2 million in 2021, and it is likely to increase to 124.8 million in 2045. Now you understand the severity of this condition. We have to understand now where we are going wrong and how to prevent its occurrence, or also learn the ways to better management. First, begin with understanding what diabetes is and what are different types of diabetes. What is diabetes? Diabetes is a metabolic disease that causes high blood sugar. In diabetes, either body can't make the insulin or body can't use the insulin effectively. There are 4 types of diabetes. First is type 1 diabetes, which is an autoimmune disease. Second, type 2 diabetes, when body becomes resistant to insulin and sugar builds up in the blood. Third is pre-diabetes, which occurs when the blood sugar is higher than the normal but doesn't fit the criteria of type 2 diabetes. And the fourth diabetes is gestational diabetes, which is related to high blood sugar during pregnancy. These are the types of diabetes. Let us now understand what are the symptoms. You have to be observant that the diabetes symptoms could be so mild that they are hard to spot at the first. Few of these symptoms include: if you feel hungry quite often, or if you feel thirsty now and then this indicates the symptom of diabetes. Weight gain is another symptom of diabetes. Therefore, keeping your weight in control is very important. One of the symptoms of diabetes is blurry vision, that is, they can't see things clearly. Frequent urination and extreme fatigue are also symptoms of diabetes. Diabetic people should be very much careful to see that they don't get hurt or don't have any wounds, because in their body, wounds, they don't heal fast. Also, men suffering from diabetes have erectile dysfunction and poor muscle strength. Whereas in women, symptoms like urinary tract infection, yeast infection and dry, itchy skin. Now, how diabetes is caused? Let me share few specific causes of diabetes. Each type of diabetes is associated with different causes. Type 1 diabetes. The cause of type 1 diabetes is not yet completely known. Mostly, the immune system mistakenly attacks and destroys insulin-producing beta cell in pancreas. Genes may also play a role in some people. Type 2 diabetes. Our genetics and lifestyle factors play a major role in type 2 diabetes. Being overweight or obese increases the risk. Gestational diabetes. Gestational diabetes is a result of hormonal changes during pregnancy, which can cause high blood sugar. Women who are overweight when they get pregnant, or those who gain too much weight during pregnancy, are more likely to get gestational diabetes. Apart from these major causes, there are few additional factors which increase the risk of diabetes are: age 45 or older, sedentary lifestyle, having bad gestational diabetes, having pre-diabetes, having high blood pressure, high cholesterol or high triglyceride, having polycystic ovary syndrome. Diabetes is a serious condition. If not managed properly, it can cause major problems. Let us know what are those complications. High blood sugar damages organs and tissues throughout the body, which can lead the complications such as heart disease, heart attack and stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, foot damage such as infection and sore which don't heal, skin conditions such as bacterial and fungal infection, depression and dementia. So you can see every organ of our body is affected badly. Uncontrolled gestational diabetes can lead to problems that affects both the mother and baby. Hence, you have to take preventive action during pregnancy. Next is hypoglycemia. Hypoglycemia is quite common in diabetes. That is, their sugar level drops very low due to overactivity, exercise, long gap between meal, consumption of alcohol, etc. Anytime when you feel that you have a low blood sugar, like dizziness, confusion, feeling of disorientation, fainting, sinking, you should eat something immediately, especially sugar. At the time of hypoglycemia, you should avoid taking insulin. Hypoglycemia is a dangerous situation, and if it is not managed, it can lead to coma. So, all of these complications are quite risky. The moment you find any symptom, you should address that immediately. And first thing you should do is to get your blood checked. Now that you have understood what is diabetes, what are its symptoms, complications, and also the test done to diagnose diabetes, it is important to be aware of certain yogic management techniques and implement all these things so that you can manage all these things efficiently. Diabetes has to be managed lifelong. If one follows a healthy lifestyle, one could be really comfortable and keep the levels in good control. What is yogic management? Yoga focuses on regulating the 4 important pillars of life to overcome the root cause of any disease. These pillars are the ahar or food, vihar, relaxation and recreation, achar, behavioral pattern and routines, and vichar, thought process. So, ahar. Let's begin with the right food. Healthy eating is central part of managing diabetes. In some cases, changing diet is enough to control diabetes. The blood sugar rises or falls based on the type of food we eat. Starchy or sugary food make blood sugar rise rapidly. Complex carbohydrate, protein and fat can cause more gradual increase in blood sugar. Food to have. So, these are the types of food that you should eat. In yoga, we recommend light, sattvic, fibrous, easily digestible food at regular interval. No fasting, no feasting. Diabetics should also take care that the total calories taken and the portion of carbohydrate, protein and fat in each meal should remain relatively constant in each meal, since the insulin level has to be maintained. If the caloric intake varies from day to day, it becomes difficult to calculate stable insulin to keep the sugar constant. High fiber and complex carbohydrate like fruits, vegetables and whole grains like beans, sprouts, dark leafy vegetables, citric fruits, sweet potatoes, berries and tomatoes should be included in the regular diet. Also include seasonal vegetables and fruits, especially bitter gourd, karela, parval and jamun. These contain substances with antibiotic property and they have a blood glucose lowering effect. In dairy products, you should have low fat milk and yogurt. Eat healthy fats such as olive oil and nuts. Also take low glycemic index food like pulses. In order to keep blood sugar level steady, eat 4 small meals throughout the day and have a fruit and lemon water in between meals. Ensure to eat low calorie food as weight management is important for diabetics. If you experience a symptom of hypoglycemia, then quickly drink sweet lemon juice or a fruit juice or a teaspoon of honey or sugar. Also carry with you some candies, dates, nuts, roasted gram, chana or dry food in the bag. While exercising, you must remember to have a fruit or cup of milk before 30 minutes of exercise. And immediately after exercising, have some dry fruits, buttermilk or milk. This will prevent hypoglycemia. High blood sugar can cause body to lose fluid and the skin gets dried. Therefore, drink plenty of water and other drinks like buttermilk, lemon water to help the skin stay healthy. We have recently shared a complete diabetes weekly meal plan. You can follow that plan and stay healthy. Along with knowing what food you should have, you should also be aware of food what you should avoid. First and foremost, you should not skip meals. Next, avoid starchy food like potatoes and sabudana and polished white rice. Completely avoid high glycemic index foods made with processed flour, sugary drinks and juices. Fruits to be avoided are grapes, mangoes, chickus, custard apples, bananas. These should be avoided because they have a very high sugar content. If eaten in small proportion, like not a complete mango but 2 slices of mango, they are not harmful since they are seasonal and not harmful. Oil is strictly restricted to 2 to 3 teaspoons for the whole day. This would keep the calories under check as diabetes need to manage their weight and cholesterol level. Completely avoid saturated and trans fat, non-vegetarian food, sugary drinks like carbonated drinks, fruit juices, sugarcane juice, any other hot or cold beverage with sugar. Avoid sweets like mithai, cakes and ice cream. Also totally refrain from smoking and drinking. Now let's understand Vihar. Next is Vihar or rest, which is another very important factor for good health. Even recreation is most important. Recreation techniques such as short walks to improve stamina, doing small errands, household chores, gardening. These are great ways to keep your mind busy, and that is most important. Free mind can create lots of problems. Brisk walk 30 minutes every day, and that too in the morning, is highly beneficial. If a person is unable to walk for 30 minutes on the first day, then you gradually build up your stamina. Walking is mildest and best exercise. Yoga considers walking as a safe way of burning calories, and this would help you to relax and release tension. One should not sit at one place for a longer time. Having a hobby is very important to go away from routines and stress and tension, and person must have some or other hobby in life. Also, good night's sleep is very essential because only through rest that your body can heal itself. During the day, you should take out some time to rest. You can practice relaxation techniques like Shavasana, Dradhasana, Makarasana, Yogendra Pranayam number 4 and Nispanda Bhav. Along with these techniques, reading some book with positive message will help your mind to stay positive and better managed in various conditions. Sports like cycling, aerobics and swimming also help you stay physically active. Achar. The third most important pillar is achar or routine. Achar plays a very crucial role in everyone's life. Most importantly, your routine should effectively follow doctor's advice. Going for regular sugar checkup, regular monitoring using glucometer, all these should become part of your routine. It is very important to maintain personal hygiene as diabetics are prone to infections like fungal infection and candidiasis. After a shower each day, you should do a quick body scan. Check for the body from head to toe for cuts, sores, blisters, and ingrown toenails. Check under the arms and breast and between the legs and toes, giving extra attention to the feet. Use a big mirror to see all over. Choose to see yourself all over and watch for any cuts and scrap. If you see any of these things, treat them immediately. In case you notice sore or infection, immediately visit the doctor. Moisturize dry skin regularly as it would lead to infection. Regular exercise is very important as you are exercising muscles that could absorb glucose without the presence of insulin. It is important to get at least 30 minutes of exercise per day. To help manage diabetes, you can break up activities during day, like performing asanas in the morning, playing an active game with the family during the day, going for a brisk walk at lunchtime, and going for a walk in the evening. All these different activities get together to help improve the blood sugar control and also diabetes related complications. Always be alert to prevent hypoglycemia while exercising. As far as asanas are concerned, all the asanas are good, especially Parvatasana, Yoga Mudra, Konasana 1, 2, 3, Ardha Vatsendrasana, Pavan Muktasana, Paschimottanasana, and Hastpad Angushtasana. All of these asanas help to massage the abdominal cavity and activate pancreas. In many diabetics, the circulation to leg is faulty. So, the head-low postures like Sarvangasana and Viprit Karni could be highly beneficial. Simple foot exercises help to stimulate blood circulation in the lower extremities. You should also practice kriyas like Jalneti, Vamandhoti and Trata. Apart from asanas, pranayams are most important. Person must sit quietly and do alternate breathing pranayam. Person must breathe out long and hold the breath by putting the stomach in for some time. That is Shunyaka. In diabetes, more oxygen into the system is very much required. So when you do asana, see to it that you are following breathing rhythm properly and that itself will help in management of diabetes. Vichar. Now we come to the last most important pillar, and that is vichar. Emotional factors play a major role in our overall health, and hence the management of emotion is crucial in optimum recovery. Emotions affect all diseases and conditions. Diabetics need to be shown the link between negativity and blood sugar. Diabetics are usually perfectionists. They want everything to be done exactly as they think it is right, and that creates a lots of negativity because others are not that perfectionist as you are, and so here is a tussle, negativity. Diabetics can very easily find faults in all other people around, and that's where they have to really work hard on themselves. Good to be perfectionist, but not expecting from others. That creates the whole problem. So learn to be positive. Learn to have positive emotions like faith, joy, compassion, friendliness, and attitude of non-violence and cooperation. All these forms an important line of treatment. Practice Pratipaksha Bhavana when you are overpowered by negative emotions. Dwelling on positive emotions will help. Acceptance of disease will help you to change your mindset and improve your management of condition. Practice Dharma Bhav to take good care of your health, hygiene and diet. This should be followed as a duty towards yourself. Developing Gnana Bhav to know what is harmful for you, what is not, why you should not eat certain food, why you should not behave in a certain manner. All this is very important, and why certain hygienic rules should be strictly followed. Vairagya bhav should be required to let go the stubbornness and rigidity in personality, which helps in letting go of food which is not right for you. You should make certain decisions to not eat certain food. This decision has to come from within you and not just because your family members are telling you or your doctors are asking you to do it. Working on these 4 pillars results in a holistic approach to achieving optimal health. Ensure in your day-to-day life to focus on these 4 pillars: ahar, vihar, achar and vichar. So now you know everything about diabetes, what it is, what are the causes, symptoms and treatments. Most importantly, you are aware of the yogic management techniques for dealing with this condition and leading a very happy life without allowing the condition to control your thoughts. So follow these beneficial tips and bring a change in your mindset and improve your healing process. Namaskar.